Dr. Darcy Mahoney will facilitate our conversation today. Thank you, Ashley, and thank you to our presenters, Dr. Batra, Dr. Garcia, Dr. DeWitty, Ms. Gallegos, Dr. Garrett, and all of whom Ashley will introduce more formally soon. And I would like to thank all of you for joining us on our webinar today, Advancing Health Equity in Nursing Education. We're in the DC area, really affecting all of us nationally. I was hoping before we start today's webinar, we could take a moment and honor the 67 people who perished in the plane and helicopter accident yesterday over the Potomac River. Our thoughts and prayers are really with the families and friends and everyone grieving this really heartbreaking loss. So if you don't mind, if you could just join in a moment of silence. Okay, thank you. So today we're going to learn about two innovative programs dedicated to enhancing nursing education curricula and dismantling barriers contributing to health inequities. We'll hear how these programs work, what their outcomes are, and lessons learned. Then there'll be opportunity for you to ask questions. And really our hope in sharing this with you today is that these models will encourage you to try new things in your work and spread these models across the nation. Both of the programs today are Nursing Innovation Fund awardees. It was a competitive grant application supported by the AARP and the Robert Wood Johnson Foundation. And like any good webinar, there's a few housekeeping notes before we begin. So today's webinar is being recorded. It will be available on the Campaign for Action website. We encourage you to use the chat function to share ideas, make comments, ask questions throughout the call. After everyone presents, we'll go back and do some Q&A live. We can take them from the chat. You can raise your hand. We'd love to hear you. We'll call on you to ask your question. And during the call, if you could just keep your lines on mute unless you're the speaker. So I'm excited to get started today. Thank you all. And Ashley, turning it to you.
Great. Thank you all for being here. We've had such a wonderful turnout for this session. I think it really speaks to why we're all here, what we're trying to do, and what we're really thinking about when we think about the future of nursing. We have some great presenters lined up for you that are going to be presenting on two programs. I really love the idea of hearing from folks in the field doing innovative work that we can share ideas and best practices and maybe scale some of these programs. So the first program we're going to hear from is called the Social Mission of Associate Degree Nursing Programs. And we're going to hear about insights of social mission metrics, which is a self-assessment survey administered to associate degree nursing program leaders across the country. The program aims to establish a baseline for social mission performance and identify opportunities for improvement. We're going to hear from two wonderful colleagues. The first is Dr. Sonal Batra. Dr. Sonal Batra is a board-certified emergency medicine physician and associate professor at George Washington University School of Medicine and Health Sciences. She is the co-chief of Health Equity Section in Emergency Medicine and practices at GW Hospital and United Medical Center. She's a founding board member of the Beyond Flexner Alliance, and Dr. Batra's research focuses on social mission metrics in health professions education. She is dedicated to diversifying the healthcare workforce and has led diversity programs for DC high school students. And I'm thrilled to have her here. She is a friend and colleague of mine here in DC. We also have Dr. Rick Garcia. He is the CEO of the Organization for Associate Degree Nursing and a dedicated innovator in nursing education. With leadership roles at Miami-Dade Community College, Georgetown University, and NYU, Dr. Garcia has championed nursing workforce development in education deserts. He's also served on various state nursing boards, enhancing nursing practice and education regulations. He's a fellow of the American Academy of Occupational Health Nurses and the New York Academy of Medicine. And with that, I'll turn it back to both of you.
Thank you so much, Ashley. Well, I'm very excited to be here. As Ashley mentioned, I am a physician, so I am not a nurse, but I have done some research and work to help promote social mission in health professions education. So that includes nursing education, medical schools, dental schools, and beyond. And so that's what we're going to talk to you about today. The program that we completed as part of one of being a grantee of the Campaign for Action is a collaborative project where we administered a self-assessment survey to associate degree nursing programs across the country. And the goal of doing this was for schools or programs to better understand their own program's social mission and benchmark it to national norms. We had done this previously with other schools. So in 2019, we distributed, you can go ahead to the next slide. There we go. In 2019, we created and distributed a social mission self-assessment survey to medical schools, dental schools, and nursing schools across the country. But at that time, we did not include associate degree nursing programs. So this was really our opportunity to collaborate with the Organization for Associate Degree Nursing and Dr. Rick Garcia to do so. And so the goals of our project were to implement the self-assessment tool with ODIN member programs. And by doing that, we wanted to develop a baseline for social mission and ADN programs across the country. And so I'll show you some of our results in the next few slides. But what we were hoping to get a sense of is what's happening currently and how do individual programs and type of programs perform when it comes to different areas of social mission. When programs participated, we gave them an individualized, confidential feedback report. So they had a sense of how their program performed compared to all of the rest of the cohort that participated in the survey. And the bigger picture goal here was really to elevate the social mission conversation among ADN programs, to get this into the conversation, and also to highlight the fact that ADN programs represent a huge opportunity for enhancing equity in nursing education and practice. You can go on to the next slide. So I've already mentioned the term social mission several times, but I wanted to make sure that I provided a definition. So this is a definition that's used by the Social Mission Alliance, where a lot of this work grew from. And it says social mission is the contribution of the school in its mission, program, and the performance of its graduates, faculty, and leadership in advancing health equity and addressing health disparities of the society in which it exists. I am seeing some chat about slides. Should I pause for a moment?
Yeah, Aiden, it seems like
others can see them. I think it's just
Okay.
a couple of people that can't. So you're good to keep going.
Okay, sounds great. You can go on to the next slide.
Yep.
So we met our primary goals for this project. We started with conducting an internal review with several members of our team who were nursing educators and administrators to take the instrument that we had previously developed. As I mentioned, it was initially targeted for medical schools, dental schools, and nursing schools, but at the bachelor's and master's level. And we adapted it to make sure it was applicable to associate degree nursing programs. We sent it out to all member schools of ODIN, and we had 44 completed responses, which we analyzed. And we used that to develop this national baseline, and as I mentioned, provided confidential feedback reports to participating programs. Go ahead to the next slide. So this is an example of some of the information that was given to in the feedback reports. So all 44 programs that participated received a document that showed them how their responses to the survey put them, benchmark them in comparison to, again, the other programs that participated. And this was broken down across 11 different areas. So I know at the top of this call, it was mentioned that we were going to be discussing innovative programs that enhance health equity and nursing curricula. And that was a big part of this project, but we also looked at other aspects of a program and how it functions besides curriculum. So curriculum was a big area, but as you can see across on this slide, we also asked questions about student and faculty diversity, the school or the program's mission, what type of training and activism was happening at the school. So it was everything from what you do in your curriculum, what your policies and procedures are, and are they set up in a way to enhance health equity, and what are your students and faculty doing, even if it's not required necessarily by your school, but what is the culture of the school when it comes to community engagement and health equity. You can go on to the next slide. In addition, we collaborated with other initiatives at the Social Mission Alliance, including the Diversity Initiative, to provide schools with this diversity dashboard. So again, this is just a de-identified example from one of our participating programs. And you can see that the graph here shows the percentage of faculty and students that they reported self-identified as a given race. And then the table at the bottom, the students and faculty columns are what the school provided to us. So for example, this school reported that 45% of their students were Black or African American, and that what we added to this is giving them a comparison to the county that they're in and the state that they're in. So on the two columns on the right side, you can see we broke down the state of Virginia, the school happened to be in Virginia, and then the county in terms of the percentage of the general population that identified as each of those races. So schools already had the information on their own diversity figures, but now we were giving them some additional context as to how that compares to representation within their geographical location. Go ahead to the next slide. And then in addition, the feedback report included some resources that they could tap into that were curated by our very broad and interdisciplinary team. So again, this is just a de-identified example. This program got 4 out of 4 stars when it came to their school's mission, and 2 out of 4 stars when it came to the curriculum and how it addresses local community needs. And so they got that star rating, and in addition to that, they have some resources and examples in practice that they can go to if they're considering ways that they might want to improve or learn more about this. Next slide, please. This is an abstract that was included in a publication that came out of this paper that shows some of the broad results that we found. So there was, again, 2 components of this. One was that feedback report that I just showed you, where schools who participated received that confidential benchmarking report. But we also have this snapshot of programs across the country. So we can say that the majority of schools had courses that were related to social mission with content areas, including social determinants of health, LGBTQ health, advocacy, public health. We saw that a minority of schools had admissions policies that included holistic admissions. And I won't read through all of these here, but it was a nice snapshot into how the programs that participated were performing overall. And I think it identified some particular strengths of associate degree nursing programs, as well as some areas where they might want to consider if it fits with their overall mission and goals to look at other types of programs or other resources to improve. Go ahead to the next slide. So some promising practices, and then I'll go ahead and pass it over to Dr. Garcia in a moment. Again, I've mentioned that this was a pretty broad collaboration. So we had the Organization for Associate Degree Nursing, who was our partner from the beginning of this, as well as the New York State Action Coalition. And then, as I mentioned, I'm not a nurse, and we had some excellent health workforce researchers and partners from the Fitzhugh Mullen Institute for Health Workforce Equity and the Social Mission Alliance. So I think this really brought a lot of helpful depth to what we were doing. We were able to build off each other's expertise and connections and understanding of nursing education to make this as useful and broad-reaching as possible. We did have participation pretty broadly from across the country, although our response rate was not as high as we had hoped it would be. We still were able to get a good snapshot of different types of associate degree nursing programs from across the country. And all of that, I think, helped shape both our survey design as well as our dissemination efforts. Next slide, please. And then the last slide that I'll talk about, this kind of recaps some of the information from the abstracts, but adds a little bit more detail. We saw that the vast majority of programs included curricular content on social determinants of health, and then many on those other aspects of social mission. I mentioned that a minority of program had holistics and missions processes, but almost half required some type of anti-bias training for admissions. In addition to this overall descriptive snapshot, we did some comparative analyses as well. So we looked at differences in programs by ownership status, so whether they were public or private, and found that public institutions in general demonstrated stronger social mission performance for private ones. And this echoes some findings that we had from the previous study I mentioned on dental, medical, and other types of nursing education, where we do see overall stronger social mission in public programs, although that's not going to be universal across every program, of course. And we also saw that smaller programs were doing a really excellent job in integrating equity-focused content into curricula, more so than larger programs. And I think some of these comparative findings help us start to think about policy and programmatic initiatives that we might undertake to enhance social mission across all education. Next slide, please.
Thank you, Dr. Batra. So one of the things that the team did, being very diverse from an interdisciplinary perspective, is that we each brought our expertise and really wanted to provide some additional context surrounding the areas, the quantitative areas of the survey. So we also had a qualitative component to the survey, which is provided here as the data, the qualitative data that the participants shared with us, which really helped to contextualize some of the quantitative areas. Specifically, Dr. Batra mentioned the confidential feedback that allowed for programs to benchmark against the respondents in their county and state was really helpful, because there's national data from areas such as the National Council State Boards of Nursing on the NCLEX report on academic performance on licensure exams. However, from a social mission perspective, frequently leadership is looking to see how do we compare within our county, within our state, within our region, and nationally. So this really provided some germane information for programs to use in their systematic program of evaluation through their national nursing accrediting bodies. In addition, there was the availability for that internal analysis of institutional practices that inform the varied representation perspectives beyond ethnicity and race, as we discussed within ADN programs. On slide 13, if you could please advance the slides. This slide provides some additional context regarding the dismantling of DEI initiatives across the US that we have seen, and that the Chronicle of Higher Education has been monitoring through their interactive website with regards to following what's actually going on within and across the US at institutions of higher learning. And I've just dropped into the chat that interactive website with that additional information. One of the elements that caught our attention, Dr. Batra and I are both real big believers with regards to owning limitations of studies and surveys. And one that we really had to own was we believe that based on the timing and the fact that faculty in there's a high percentage of faculty in community colleges and colleges that are on a 9-month contract, and the timing of the survey may not have aligned with the most ideal time. I believe that it was launched and the survey period was open over the summer months, which would have been basically the vacation or the summer leave for faculty. So that was one of the lessons learned, and certainly something that is at the top of mind for us as we look to seek additional funding opportunities to relaunch and resurvey this particular target audience with an ideal time and period for the survey to be conducted. On the next slide, some of the areas that we looked at specifically with post-project plans included to refine and share the survey mission metrics self-assessment, expand surveys to other health professions, including medical schools. And Dr. Batra mentioned that it has been distributed to medical schools. To promote collaboration between private and public institutions to share best practices, and lastly, to secure some funding to sustain research and advance equity initiatives in this space. And on the next slide, this analysis offers a framework to advance the social mission of nursing education and overcome barriers to diversity, equity, and inclusion, fostering impactful collaboration among institutions, stakeholders, and policymakers. So it's certainly helping to guide best practices and educational policy formulation and development within this space. That concludes our presentation. I'd like to pass it back to Dr. Darcy Mahoney to introduce our Utah colleagues. Thank you.
Wonderful. Thank you so much. The next presentation we're going to hear is called Hitting the Bullseye on Structural Racism in Nursing Education. And we have 3 wonderful presenters for this one as well. And so I'm going to go through each of their bios. So first I have Dr. Vernell DeWitty. Dr. Vernell DeWitty is a pioneering leader in diversity, equity, and inclusion within nursing. As the first Chief DEI Officer of the American Association of Colleges of Nursing, she has reshaped nursing education nationwide. She's directed Robert Wood Johnson New Careers in Nursing program, increasing diversity across 130 schools. She's creator of the LAMP Culture Survey, and Dr. DeWitty is recognized expert in fostering inclusive academic environments. She's a fellow in the American Academy of Nursing, the National Black Nurses Association, and the Academy of Diversity Leaders in Nursing. Next up, Ms. Joan Gallegos. Joan is the co-lead of the Utah Action Coalition and working to implement the National Academy of Medicine's Future of Nursing recommendations. With over 40 years of experience in nursing, behavioral health, and public policy, she is committed to enhancing the resiliency of nursing and diversifying the nursing workforce in Utah. Ms. Gallegos also manages grants promoting inclusivity in nursing education. And then lastly for this group, Dr. Teresa Garrett is an associate professor at the University of Utah College of Nursing and co-lead of the Utah Action Coalition. With a Doctor of Nursing Practice degree from the University of Utah, she is dedicated to leadership, health policy, and equity in nursing education. She co-leads an innovations grant to eliminate structural racism in nursing and an active community volunteer in her area. So I'm going to turn it over to you all to tell us about your program on the extension of the community health outcomes curriculum and how it's being utilized to identify and dismantle barriers contributing to structural racism in nursing education.
Thank you very much. This is Joan, and I'm going to lead off the presentation for our group here. And just first off, this is a grant that the Utah Action Coalition applied for and got from the AARP Foundation and the Center to Champion Nursing in America. We've been a pretty active action coalition. We were founded in 2020. We've done a lot of work on implementing the first report on the future of nursing in America, and now we're working on the second report. So we like to say we're kind of a coalition of the mighty here in Utah, but not an incorporated organization, and we kind of like it that way. Let me just give you an overview a little bit of our grant. We conducted a survey of 65 diverse nurses at one of our large colleges. And we had survey participants from BSN programs, MSN, DMP, and PhD programs. And the findings were pretty stunning. Let me just give you some of the findings that we found. The application process for diverse nurses includes inherent barriers, biases for racially and ethnic diverse students. The curriculum does not adequately address the needs of these students. The students' personal experiences were more helpful, we found, in preparing them to care for patients of different racial and ethnic backgrounds than the college nursing curriculum. Current and proposed opportunities for mentoring, connecting, and belonging in the nursing program were lacking, and the program could provide a lot more support for racially and ethnically diverse students. And students regularly cited racism and discrimination as being experienced in classroom and clinical settings. So this really prompted Dr. Garrett and I to act. This was pretty heavy stuff. So we applied for this grant, and we designed the curriculum with based off of the findings that we got from these diverse students. Dr. Garrett and I realized early on that we needed national expert help with this. And we let an RFP, and to our delight, Dr. Vernell DeWitty applied and was the winner of the RFP selection process. We couldn't do this work without Dr. DeWitty, and your introduction of her was right on. She's a national expert on this. So Dr. DeWitty basically took these findings from diverse nurses to design the curriculum, and she's going to speak about it in a minute. But I think I need to just pause for a minute and let you know what is an echo session, because that's how we basically rolled out the curriculum, was through the ECHO platform. ECHO is an acronym for Extension for Community Care Outcomes. And know that the ECHO program was developed at the University of New Mexico to really provide a virtual learning community, which helped rural doctors and nurses connect with care through urban specialists to treat widespread untreated hepatitis C in their state. The ECHO program uses technology platforms to connect and share knowledge, to provide the care when and where patients need it, allowing the patients to remain close at home. We thought this would be a great curriculum platform for this program because it allowed us to connect with faculty, nursing faculty across the state, rural and urban, large public universities, smaller universities that are not public. And what was nice about it, it allowed us to share the curriculum, but also then we were able to break into diverse groups with case examples to actually apply what was being learned and share our discussions, items, and what we were struggling with the whole group. And just a brief overview before I turn it over to Dr. DeWitty here. She developed the program. We had 6 ECHO sessions, and we did them once per month over a period of 6 months. We had 4 nursing programs that were selected as pilot sites for this: a public, private, urban, rural, small, and large enrollment programs, and approximately 20 faculty were participants. I don't know what all that noise is. What is going on there?
Everyone, and then Joan, you'll probably need to unmute.
Okay, all right.
I just muted the person that was
Thank you.
making the noise. Yeah.
Thank you very much. It was very distracting, sorry. Each faculty member that was involved with our sessions completed a profile, which was an intercultural development inventory, which assesses where that individual is
Joan, you're on mute.
Back on mute. Okay.
You're good now.
You can hear me now, correct?
Yes.
Okay. I'm going to just go back a minute. Each faculty member completed a profile, which is called an intercultural developmental inventory, which assesses where the individual was at, and they could develop an individualized plan for growth on cultural differences and commonalities. And we had a group profile too. We collected data on key evaluation metrics after each echo session, and CEUs were offered to the faculty attending as an incentive to participate. Each echo session, we discussed this curriculum with case examples. And at the end, each nursing program was asked to develop a plan to implement changes to their programs to make them more inclusive and accepting of all students. That was to be student advisory groups, diverse student advisory groups, to be formed to advise the deans of these 4 programs on the implementation of these recommendations. Dr. Garrett will be discussing that issue. We had a little blip, I would say a big blip, with our Utah legislature that prohibited DEI programs in the middle of this grant, and we were advised by attorneys for higher education we could not form these diverse advisory groups of students, that would violate our state laws. So she'll talk more about that, but I'm going to hand it over to Dr. DeWitty now to talk about the meat and potatoes of what we did. Thank you.
Okay, thank you so very much. I'm Vernell DeWitty, and I want you to, could you go back a slide, please, before we move on? Thank you. I had the distinct pleasure to work with the Utah Action Coalition to assist in actualizing the dream that they had when they developed their grant proposal. And as Joan has indicated to you, we looked at their survey findings to build a curriculum that would reflect the areas of concern that had been expressed by the participants of that initial survey. And the echo sessions were as listed on this slide. We first of all introduced the group to what an echo session was so that they would be more comfortable in terms of the interaction in the breakout rooms. After content was presented, which was about 30 minutes, the group went into a breakout room where they spent about another 30 minutes. And then there was a group discussion, and that's where the real learning took place and where participants were able to express ideas, thoughts, opinions, and hopefully to learn and grow together about some of the issues that would interfere with having inclusive learning environments, that would prevent fostering student belongingness. We talked about also allyship in nursing education and spent a lot of time, which was, I think, very interesting, looking at what happens in the clinical setting. And when issues arise in the clinical setting, how faculty address some of those issues, especially as it relates to diversity in terms of patients and providers. We also spent time talking about faculty recruitment, retention, and our very last session is when the schools were asked to take the knowledge that they had gained and then think about how they might create goals and direction for when they would go back to their schools and then begin to apply what had been learning. Next slide, please. One of the things that we had not originally decided before we launched the sessions was that we were going to provide continuing education units for participants. That was an incentive for them. And it also allowed us to collect data and have each one of the sessions evaluated by participants. And these are some of the outcomes in terms of knowledge gained by participants. We did a pre-test where we asked them how knowledgeable they were before starting the echo sessions, and then after the session, what was their level of knowledge. We noted that in the evaluation data, the number of participants who were extremely high with extremely high knowledge before sessions was increased by almost 200%, going from 4 to 16 during the post section. We also noticed that the next slide, please. The participants also indicated that they would more likely be able to introduce the new skills and knowledge that they had learned in the echo sessions. You see that 92% said it was very likely, and a mere 6.7% said it was somewhat likely. And we looked a little bit deeper into that to understand the reasons why they may not be able to implement what they had learned. A lot of it had to do with the leadership. Next slide, please. We also wanted to know how confident they were in their ability to apply what had been learned. The intent was you learned something, but then you were able to take it back to your practice setting and then be able to apply it. And we see that 56% felt confident in their ability to apply what they had learned, and 42% were moderately confident. And I think this is really an important finding because it indicates the ability of the learners to apply it, even though they're not going to apply it in the structure that had been envisioned at the outset of the grant, because they were to go back to their schools and then create groups. Now that that is not possible, this is perhaps an indication that because they were confident about the knowledge that had been gained, that they will still then be able to apply it, although not in the exact manner that was envisioned, but it will influence how they interact with students in their classrooms. Next slide, please. And I'm going to turn this section over to Dr. Teresa Garrett to talk about promising practices.
Good afternoon, everyone. It's a pleasure to be here today with all of you. This opportunity to engage with 20 nursing faculty across the state of Utah was a pretty amazing series of conversations over a 6-month period of time. The faculty that we worked with were from, as Joan mentioned, a variety of programs and places. I think we saw the most change in the faculty that came from the rural areas of our state. And faculty mentioned in the evaluations that we completed with each session, we asked faculty, what's one thing that you will change in your practice? And here are a few examples. Pretty exciting to hear faculty say, I will have discussions with my clinical students about the bias they observe, as well as help them explore their personal biases. That's a whole new conversation in nursing education for us. And also talking about how I will change my interactions with students in post-clinical conferences to talk about what they've seen and how they might do things differently. I wanted to share another quote that we received. One of the things we talked about a lot was how do we move from here's what we all have in common. So sort of that, we're all the same. We're all here to take care of patients. We're all here to provide good quality care, to acknowledging that we are all different and that we should celebrate those differences. And when we celebrate differences, we bring everyone into the room and into the conversation. And one faculty said just that. Instead of just focusing on bridging commonalities, I will lean into celebrating differences more. these are just a few responses that we received in our evaluation information that demonstrates that the content and the focus on building skills and really helping faculty know how to address these issues and how to prevent them from happening to beginning with, demonstrated that our content landed with our faculty participants. Next slide. So, as Joan mentioned, during our legislative session in 2024, our legislature meets annually, January through March, for 45 mock speed days of policymaking. And Joan and I are usually pretty engaged in that process for our Action Coalition. Our legislature early in the session passed legislation, like many other states, banning the use of diversity, equity, and inclusion programs in our public universities. Our public universities actually had done quite a bit of work in this area to help everyone succeed. And by July 1st, across all 8 public universities, every diversity program in our state was gone. So what we know is that the values of the nursing profession haven't changed, and they won't change. And in fact, in the new statement just published by the ANA, they've been reinforced. We also know that nurse educators need very specific skills to help new nurses care for diverse populations, and that we have to respond and adapt quickly and nimbly to this rapidly changing policy environment. We started this work calling it Eliminating Structural Racism from Nursing Education. While we were working with Dr. DeWitty, we transitioned to dismantling it. And now we're building bridges to health equity. So we're adapting, we're continuing on with this work, and hoping to move forward with new grants, new opportunities, and continued interest in helping faculty members build their skills to help us have the most diverse and capable workforce out there. Thank you.
Thank you all, both groups, for really wonderful presentations. I think that last part is something that we all are really deeply thinking about now across all states. And so perhaps there is some opportunity for questions around that. So I'm going to give folks a few minutes to put their questions in the chat, but I do have a couple questions that came in as you all were talking. And so I'm going to start with those, and then we'll jump into others in the chat, if that's all right. So for the first group, the project team has a really diverse group involved. Actually, this is really for both groups. Each of your projects teams have really diverse groups of people involved, from interdisciplinary groups. We see social workers, physicians, and nurses partnering in both spaces. And we also have different types of people in all your spaces. Can you describe what was that like, how it impacted your work? In particular, how did it really enhance the work you all are doing?
Great. I can start this, and Sonal, you can jump in. I think one of the great richness that our team brought was the professional diversity, as well as our own individual diversity as educators, researchers, practitioners. And, as we know, research science is a team sport. So you want to have a group of colleagues that works well together, that have particular talents that they can contribute to the project. And it also increases the robustness of the actual work, because everyone brings their own lens in applying to get to those terminal objectives. So I think that's really was very positive among our team, to have both clinicians, non-clinicians, advocacy groups involved. Turn it over to our Utah colleagues.
I would say that in the Utah Action Coalition, our work is team sport, and we don't do anything by ourselves. And all of our work is enriched by a diverse group of people helping and guiding us. And we are we're very fortunate to have some lead faculty in key places who have, well, they aren't part of the wall of well-meaning white women who teach most of the nursing education here in Utah. So that brought depth and understanding and more creativity to the work that we were doing. And we're very grateful for that.
Okay, if I could chime in with another comment. I think the work that was done in terms of collecting data from the survey that was done at the University of Utah, and that was a real collaborative effort, as I recall it. And in the echo sessions, there were faculty members. We also had admission officers. We had persons who worked in student success, so that we had the voices of persons across the campus, so that I think there was some good conversation and interaction between the persons who were admitting the students into the programs and the individuals who were then guiding the students along the way, as well as the faculty members. And I think that added a real uniqueness to the richness of the conversations that took place in the echo sessions.
Great. So I have another question here. So in recent years, and specifically in recent days, we've seen increasing restrictions at both state and federal levels on DEI initiatives in healthcare and in public education specifically. Given these challenges, can you all in Utah kind of tell us how you all navigated that in relationship to your program and this grant? You talked about it a little bit, but can you give us some specifics? What did you change to ensure that you were complying with your state laws, but still driving the work forward? Joan, you're on mute. I see you talking, but you're on mute.
I'll start off with this. You know, when our Utah legislature passed this law, and it was passed within the first 2 weeks of our session, and we learned that our governor was behind it, it got a lot of publicity. And we had a lot of concerns from our grant participants, the faculty, about what this all meant. We had to pivot, talk about this, really have some candid conversations about what this meant. And as Dr. Garrett emphasized, you know, it doesn't mean that our nursing ethics and our values have changed. Yet we have to comply with the Utah law. So Dr. DeWitty, very adeptly at the beginning of each of these echo sessions, allowed us to talk about this and what was going on in our state. And we really had to pivot in some ways to, you know, more building bridges to health equity. We all want all students to succeed. We had to pivot in that direction. And we had to change our nomenclature. And again, like I said previously, the last part of our grant that we had proposed about having diverse students come together to advise our deans, you know, we took all this to the attorneys, and they very much advised us that we were not going to be in compliance with state law if we did that. So we basically turned that function over of the plans to all the students, because we want all students to succeed and to bloom and to enter the nursing profession in the best way possible.
Got a hole in it.
I'm sorry. Okay. I thought somebody asked a question or something.
I have
Is
a
that
question, John?
Yes.
Joan, sorry. When you did open it up to all, did you have a different experience, or did the initial students you expected to come? How did that go?
When we opened it up, it was faculty that were attending the echo sessions. So they were the ones that, you know, they expressed some real fears, you know, and unfortunately, part of our Utah law is you can get reported if you do this. So there was, like, you know, a threat of being reported. And, I hate to say this, but some of our faculty, even some that were participating in it, actually got some very nasty emails from people about participating. So there was really some icky stuff that happened. In terms of our students, when we rolled it out to the faculty, we just had to be very clear that this has to be implemented and oversaw by all students so
Right.
that we're not on skating on thin ice with the Utah law. Others, Teresa, Dr. DeWitty, do you want to add? Okay, thanks.
Well, in relation to the anti DEI movement that's taking place in all across the country, and you can Rick put the link to Inside Higher Ed Tracker so that you can see where the legislation now is in all of the states, so that you can look at your own state to see what's going on. And given the larger geopolitical climate, I think it's probably prudent to speak to the academic success and advancement for all students, because at the end of the day, the aim was to be able to prepare a diverse workforce to provide care for a diverse population of patients. So when we think about what the underlying goal is in terms of our mission, in terms in terms of our what our mission is and what we're hoping to achieve, it was really about how do we provide better care for patients? How do we reduce health disparities and inequities? And to do that, having a diverse workforce is one of the strategies. And thinking about then how do you ensure academic success for all students, helping students to all feel that they belong in the learning environment where they come. And I think if we can focus on what the main goal is, what the end goal is, and use words that reflect that, speaking to health equity, speaking to reducing disparities,
Mhm.
fostering belongingness in all students.
Thanks, Dr. Dewey. The
Very
next-
well said. If I might add one comment, I think one area that we've noticed an impact that I don't think would have happened if we hadn't had this legislation passed in our state is that with the faculty, with the individual school plans, they developed I think Dr. Garrett and I needed to give a lot, and I emphasize a lot more support to the faculty to implement this, because I think there was generally feelings of some fear. And, as I mentioned, some of the diverse equity faculty were actually targeted with nasty emails. There was a fear of being reported. So, our post echo sessions didn't go as smoothly because of the climate this all created. And there was a fear factor. So it required a lot more support. Teresa, go ahead.
Dr. Garrett, I'm going to come back to you in just a second, but I know Dr. Garcia has a small window, but I promise I'm going to come right back to you, okay? I have a question here before Dr. Garcia leaves, although we can take more questions for Dr. Batra, but before he leaves, this is a little bit complex. So the social mission metrics self-assessment survey includes diversity in the admissions, so it's kind of along the same lines questions, as a metric. And so there's some question about with respect to the recent Supreme Court rulings and executive orders on affirmative action, DEI, how can health profession schools continue advancing social mission while staying within these legal boundaries? And I know, Sonal, you might be able to speak to, I believe that the accreditation body for medical schools requires some diversity data, while the schools of nursing accrediting bodies do not. So that might be something to note in here.
Ashley, thank you. That is quite a complex question, and I have a lot of skills and a lot of talents. One of them is not interpreting law, because I don't have a JD after my name, so I'm not even going to try. I will highlight that I've been looking at the chat, and one of our colleagues, Jose, asked a great question as to how do we advance this important work during the current political environment, and especially with some of the direction that the current administration has put out. And I'd like to quote one of my colleagues in Florida who has been dealing with this for quite some time, Dr. Desiree Diaz. I think is a great beacon in this space, because she says, I'm not talking about diversity, I'm not talking about inclusion, I'm not talking about equity, I'm not talking about belonging, I'm talking about facts. The facts are that Black and brown mothers die at 3.5 times greater during maternity care than any other group. It's an issue of health equality. It's an issue of minimizing health disparities and inequalities, and making sure that everyone has the most effective and precision medicine, if we need to cite that, precision medicine approach to their care. So it's really about that. I, as you know, a CEO of Odin, we have members across the United States and Bermuda, and all of our members are in very different political climates. So we have to go for the collective, and we are moving towards the collective, and looking at the facts of the matter and advocating for health equity. That's the real perspective there that we need to keep our eyes on. And I'm viewing this period very positively in keeping focused on what is important. And the important things are the statistics that we need to turn the direction that they're heading. Thank you.
Great, thanks, Dr. Batra.
Yeah, I'll just add, I'm glad, Rick, that you're viewing things positively. I'm struggling with that at the moment, so I don't have too much to add. I will just comment on, Ashley mentioned the issue with accreditation standards, and I see some comments in the chat that point out various places where reporting on representational diversity is currently required. I think that, right, I think it's going to be challenging and evolving, and I don't envy those who are in various positions who have to deal with this very much more directly. But it is true that medical schools their accreditation standards do require schools to have explicit programs that are aimed to advance diversity and racial and ethnic diversity, as do dental schools. I'll drop in the chat in a moment a review that we did of accreditation standards across health professions that was actually commented on in the Future of Nursing 2020 to 2030 report. I think that right now, there are these, there's an ability for when things are required for accreditation standards, or because of union requirements, or for whatever other reason, that efforts to promote diversity, equity, and inclusion can still go forward. But I don't know, what the future of that will look like. And I think there have been efforts by those in states where this legislation has been in place, like Utah, for longer, to find workarounds, right? To focus on health outcomes statistics, to focus on, or sometimes changing terminology, and making sure that we're framing things in a way that is in fact reflective of our goals, which is to advance health and to improve health outcomes for all, as well as to reduce health disparities. But I think that framing can only go so far. I think sometimes we really do need to talk about the fact that we need better representation, and that we do need to focus on specific populations that have had worse outcomes historically and continue to do so. And I think the challenge is going to be how we do both of those things, right? So how we stay compliant with what we need to do, but not go so far in couching everything in terms that are considered acceptable that we kind of lose sight of the fact that these disparities do exist. I don't have an answer. I'm just throwing it out there.
Yeah, thank you so much. I know since it was in your survey, it was something that had come up in a chat question. I'm going to see if anyone wants to raise their hand now. I'm going to give people an opportunity to sort of hear your voices. I've gone through quite a few of the chat. I don't want to say I've done everything, but anything that came to me or that I saw and tried to put together.
Jen,
So it
Jen,
looks like
can we go back to Teresa, because I don't think she had a
with their
chat.
Mormon selves, just Mormon.
if you could just mute yourself,
Wait.
and I'll go to Dr. Garrett next, and then
Thank you.
You're welcome. And then I'll go down the line for the hands that are raised. So Dr. Garrett, and then if you'd like to raise your hand, go ahead and do that.
Thanks. I'll be quick. I just wanted to mention in the time frame where we were doing this particular session, from February to early June, we had a window of opportunity. We had a small gift from our legislature, and that was the date of July 1. The other small gift we had was that if you had money from a grant to do this equity work, and that grant was not state funding, then you were fine. Moving forward, so the law was implemented as of July 1. So pretty much we could do what we needed and wanted to do up to July 1. Well, now we're in a new day. We don't quite have those same federal protections that we had in the previous administration, and we're getting ready to run another session. So we're adapting our curriculum and really focusing in on the principles that Vernell mentioned. But I think we were lucky in having that first early window of opportunity to at least run things once and try it before having to do an adaptation. So thanks.
Yeah, of course. Thank you. Isolina, it looks like you had your hand raised.
You're on mute, Isolina. Top, there's a microphone. You click that to unmute you.
While she's working on that, do we have any other questions in the audience by chat, or if you'd like to raise your hand, we'd love to hear from you.
If you can help get her off mute.
Right, I have one other question that just came through. I think this is perhaps for both programs, but what kind of impact on, so maybe Dr. Garcia, Dr. Batra, what kind of impact on individual programs did the sort of social mission metrics survey, that self-study have? Did you guys learn of any changes in programs after that study? And then how can we sort of think about scaling that?
Sonal, do you want to take that one?
Sure, yeah. So we did, with our partners from the New York State Action Coalition, we reached out to a subset of schools that had participated in the survey to ask that very question: what kind of impact did it have on your program, as well as some kind of background context of like, why did you choose to participate in the survey in the first place, and what is the current status of social mission at your institution? And I think that, you know, given the timing of when we asked this, was a 1-year grant, and so we asked those questions within a month or so of schools receiving the feedback report. So at that time, there hadn't likely been enough time to see longer term changes or bigger changes, but we did have a few schools. There was a common theme of saying that they would be going back to reference the feedback report and the metrics when they were thinking about strategic planning. So I think a lot of it came to timing of what was going on with the program leadership at the time. So we had an example of a ADN program leader who talked about they were in the middle of working on a new strategic plan, and that this information that they gleaned from participating in the survey and the resources could be used to inform that. And then another one who reported that they were
likely going to be taking over as leader or as a chair in their department, and similarly would be going back to the benchmarking information that they received from that program when they were thinking about how to evaluate what they were doing and specific programs at their institution.
Great.
And I'll actually just add one more thing that speaks to our last goal, which was really to elevate this conversation. We had a number of program leaders that stated that they might have been doing some things in some areas when it came to diversity, equity, and inclusion. And just by the fact that so many ADN programs are at community colleges, there is often kind of inherent equity-focused mission at these institutions. But this gave them kind of some more verbiage, some more ability to talk about this with a broader audience. Because we, going back prior to this project, we asked similar questions of medical and dental and other nursing schools that had participated in previous versions of the survey. And that was another theme that emerged, which was now they had something that they could show to external stakeholders, like a board of directors or even to students, to demonstrate, here's some things that we've made a lot of progress on, and here's how we're demonstrating that. And also, we need more resources for these other areas. Go ahead, Rick.
Thank you. One of the things that was really important to us also was to disseminate this work so that it would be available to everyone that participated in the study, but also for those that were not able to participate. So one of the things that was very important to us was to actually be able to provide this manuscript for dissemination in an open access format. So the Teaching and Learning in Nursing, which is Odin's official journal, went ahead. We worked with Elsevier, and Elsevier allowed us to make this open access. And I've put the link in the chat for those that are interested to download the manuscript and read more about our work there. Thank you.
Hey, Selena's off mute now. Yay.
Yes. Thank you very much. I thank all of you all for the wonderful, I thank you for the wonderful work and doing everything together. I'm a nurse of 43 years, have gone through actual diversity problems myself, as I'm brown. I'm also Hispanic, and had a lot of problems, both with managers in the nursing program. When I started the nursing program, it was very hard. And there was a lot of problems with diversity during the time when I first started. So I think the work that you all are doing, and even in this time of 2024, and just in the past few years, I've had issues where there were nurses who I didn't even know that were actually prejudiced against me because they didn't want to work underneath me because I'm brown color and I happen to be Hispanic, and the Hispanic people tend to love somebody who's actually from their own culture to make them feel more comfortable. I had to deal with that. And if we have students, nursing students, doctors, there are so many that I have encouraged to move on and not be afraid just because they happen to be Latino or because they happen to be brown, to move on and be able to do the things that they want to do in their own ideas of becoming a doctor or becoming a nurse. So the work that you all are doing, I hope that it doesn't stop. I would like to see it continuing. I do go call my representative, and I will be calling him also continuously here because I don't agree with taking away the diversity programs with the current administration. So I think it's important. Please continue all your work that you have been doing. Thank you.
Thank you for that. Thank you for helping us to give voice to some of this and stories to this. Dr. Garrett?
Yeah, Isolina, thank you so much for your many years of contributions of making healthcare better. We're very grateful for you. Thank you, thank you, thank you. And I gotta say, that's the plan. Joan and I and Vernell, because Vernell's now part of our team, we're pretty persistent and we're not going to stop. We're going to adapt. We're going to be nimble. we're going to do the very best we can. I just had a conversation with the dean at our college about how we could include this work in educating preceptors, because that's another area where we have a gap in helping them help students and families come together. We're moving on. We're going to continue marching. We got work to do.
So there was a question.
And just to add to Teresa's comment, I didn't put that, in my comments earlier, but our study of the 65 diverse nursing students with the problems, a lot of problems with preceptors in the field. So Dr. Marlo DeYoung at the Dean of the College of Nursing is right on to look at that in preceptors, because that's where our diverse students got really hammered in some ways. Thank you.
Sure. There was a question in the chat about whether the social mission metric studies would be extended to other health profession schools. Sonal, I went ahead and linked to your JAMA publication from 2022, but perhaps you have more to say on that.
Yeah, so as I mentioned, this was initially released to other health professions back in 2019, and then this program with the associate degree nursing programs in 2023. More recently, it was redistributed to medical students. I can put in a link to the Social Mission Alliance that's really running that work. I was leading that program for a few years and now have kind of shifted focus to some other things, but the work is still ongoing. And so the decision was made to focus on one profession at a time. And the hope is to be able to redistribute it and continue to adapt it, both to geopolitical changes and also to kind of just the world more broadly in terms of what we should be thinking about what health equity actually means. And so that continued dissemination every few years ideally would allow schools to be able to see how their progress is changing over time in a meaningful way.
Okay, well, I think we are through all of the questions. I'd like to see if anyone on the panel has any last parting words for us before we close our session today.
Ashley, I would like to thank everyone for making this a priority to attend. And I would also like to echo Sonal's comments earlier that, the importance of this cross-section data is so important, but it can't be a one and done. It has to be something that's tracked over time to see the movement of the needle and to actually identify or re-identify new priorities that need to be worked on or advanced through either policy development or policy work. And I know, Vernell, you and I have been in this space and worked this, so I know that I'm preaching to the choir, but I'm sure that you have some thoughts on that as well. Thank you.
I would just like to say that although the times are challenging and the context in which we work has changed, it's important that we remember our purpose and what it is that we're trying to achieve. And I think if we can hold fast to that, we can continue to work regardless of what changes in the geopolitical climate right now.
I see Dr. Susan Reinhardt, part of our fearless leadership here for the Campaign for Nursing, and now in new and different and exciting roles, but we would love to hear from you.
Well, I just really wanted to thank, recognize and thank you and Jennifer Peed and the entire team for not just today, but everything it took to get these grants out and to support. So it's just so great to really see things come to fruition and appreciate all of the wisdom that you've been gaining and how to navigate going forward. It's been really enlightening for me. So I want to thank all of you.
Well, thank you, Susan. Thank you for your leadership. You were at the helm that brought us to this place. So,
Part of many. Thank you.
Yeah. And I will say this webinar, over 100. It was like 120 at some point. We don't get that kind of numbers usually per topic, so it just speaks to how hungry the field is for this, and this has to continue. So you guys are doing amazing work, and state champions. I know it's 40 years for some of you doing this work, and we're still at it, but we won't be deterred.
Okay, well, I will close this out here. I just want to highlight that there are some really wonderful things happening in February. Someone already linked to the Culture of Health at the National Academy of Medicine on February 6th and 7th. It's a wonderful 2-day meeting that will highlight efforts by the National Academy of Medicine Culture of Health program and RWJ and the work that we're doing there. So please feel free to sign up. One of the days is in person, one of the days is virtual. And then I also know that ANA is having an in-person program here in Washington, D.C. at the end of February. So hope you all can join. I know many of you will be there. Thank you for your work, your commitment, and we look forward to continuing the conversation.
Thank you. Thank you, Ashley. Thank you, panelists. Thank you, guests. We appreciate all of you. The webinar will be recorded up on the website in a couple of days, and we'll see you again. Thank you. Be safe.
Bye-bye. Thank you.